Hello, I am Stephanie, and this is my audience right here today watching me talk about my persuasive speech outline on the blood or that blood pressure should be necessary to avoid or taking it to avoid helping it avoid heart disease. So, with that said, I just wanted to start off by giving an example of a patient that I was seeing in a post-op appointment 2 weeks after their hip. They started to say they didn't feel well. They then started to get a droopy side of their face. They said they needed water. They started to have slurring words. They also yelled. I had to yell for help. Their blood pressure at that time was 120 or 190 over 120. We called EMS. His wife said that he had not taken his blood pressure medication that morning due to being an early morning appointment. He did have a history of hypertension. He was on 3 blood pressure medications. And he did end up going to the hospital, was confirmed to have a stroke. Just wanted to make sure we're starting off with the importance of following through on histories and doing what's prescribed to, and then we'll go into like preventative maintenance. I do have what I want to show you, and this is a, oh goodness, okay. Sorry, it scrolled up. This is the from the Mayo Clinic. It does show blood pressure ranges, what's considered low, ideal, high blood pressure, and then you can get into like a stroke area. There are 2 levels, 2 stages of pre-high blood pressure, and I'll go into those in a minute. So getting back to that, you can have stage 1 hyper blood pressure, which is usually the range of like 120 to 130, less than 80, which is your diastolic, which is your resting blood pressure. Stage 2 would be 130 to 140, and then it's anywhere from 80 to 89. Stage 3 would be anything over 140 and 90, and then hypertensive crisis would be anywhere over 180 over 120, which is what the one gentleman that was in the office with me that day had. So why you should monitor your blood pressure. High blood pressure threatens your quality of life. It can also lead to a stroke, a heart attack, and kidney failure. It has a lot to do with how your body processes things and the fusion of it. And then prevention is key, and it can lead to irreversible damage. Things you can do to prevent high blood pressure would be to maintain a healthy weight, also body mass index. Following a diet that's low in saturated fats, maintaining like a plant-based diet, having a lot of fruits and vegetables, drinking lots of water, exercising for 30 minutes, at least 3 times a week, meditate to help with that mind, body, spirit, helps to also reduce stress, monitoring your blood pressure at home if you are on daily medications, and then going to your primary care doctor to at least get a check once a week if you are in that healthy range to make sure it's not increasing. And then if you do smoke, stop smoking. In conclusion, where do you see yourself? If you follow the steps that I suggested for you, where do you see yourself? Do you see yourself feeling good and nourished if you follow that diet? Do you see yourself feeling better about yourself in general, overall in health? Those are questions that you should ask yourself that I would like for you to get from this speech. In conclusion, again, if you take time to yourself and and be in the shoes of a family member or a loved or lost one that was in a delay of medical treatment that did lead to the stroke. How would you feel as that, family member? So please remember to take care of yourself. Prevention is key. It is a very preventable disease. They do call it the silent killer for a reason. It takes time for stress, poor eating habits, and lifestyle to catch up with our body, as it is very resilient. At this time, I would like to also challenge those of you that are taking your daily blood pressure medications to continue to do so. And then, you can possibly get off from them if you do stay, you lose weight or do try and get off that. So I'm sure the gentleman in the office did not expect to have a stroke that day. By skipping his medications. Strokes, heart attacks, and kidney failure are all due to loss of blood flow and the pressure being diminished in our bodies. So when blood pressure is high, we slowly put too much pressure on those small vessels. And that is why blood pressure is called the silent killer again. So there is much information to be found on the mayoclinic.org. And the signs and symptoms for all of these things related to long-term high blood pressure. And please don't hesitate, as it can save your life. And that is all.